Hello, my name is Hadley Owens. I'm a Master's of Science nursing student at Arkansas State University. The title of my project is Colorectal Screening Education and Patient Compliance. Colorectal cancer will afflict more than 101,420 people this year, with 44,180 cases of rectal cancer alone. In 2018, in the United States alone, colorectal cancer was the third leading cause of cancer-related deaths, which total more than 606,000 per year. Arkansas is predicted to incur over 6,730 deaths in 2020, with an estimated total of newly diagnosed colorectal cancer patients of 16,580. According to the World Cancer Research Fund, colorectal cancer is the third most commonly occurring cancer in men and the second most affecting women, with lung cancer as the primary killer for men and breast cancer as the leading cause of death in women. The purpose of this study is to identify any barriers to having indicated populations tested for colorectal cancer. For this study, the main barrier that is to be identified is whether the patient received any education from the provider regarding having a colorectal screening performed. This is a descriptive study. It's conducted at a local family clinic in Arkansas through a retrospective chart review. 61 electronic charts were randomly selected between January 1st, 2019 and February 1st, 2020. Population of the patients aged between 50 to 65 years old with a CPT code marked in their chart that indicated either a fecal biomarker or colonoscopy test had been ordered. Inclusion criteria with both male and female patients ages between 50 to 65. Charts indicating colorectal screening CPT codes of 81528 for Cologuard, which is a fecal biomarker, and 45378, which is a colonoscopy. Exclusionary criteria were male and female patients less than 50 years old and greater than 65, and patients who had had previous colonic studies performed. Analysis of the 61 patient charts indicated that only 84% of the sample population had their screenings performed. 57% of those had zero education documented in their charts, and of the 16% of patients that did not have their screenings performed, zero of those patients received any kind of education. For our discussion and action plan, the results indicate that there is some correlation between patient education and completion of colorectal screenings. This will help us establish a standard for patient education and documentation thereof. This research can be continuated, which indicates for future practice improvement. Increasing the number of colorectal screenings indicates a reduced mortality rate as a result of colorectal cancer being discovered. Utilization of fecal biomarkers presents a lower cost alternative that also provides greater privacy for some patients. Limitations for this is it was a small sample size. Data was collected from one particular clinic in Northeast Arkansas. No standard for grading patient education within the provider to patient interaction. And it's a retrospective chart review, so it doesn't allow any interviewing of patients to determine the actual cause of attrition for the patients electing not to have their colorectal screenings performed. I would like to acknowledge Dr. Christopher Jordan and Ms. Lauren Hancock for their assistance with this project.